by putting a ball under someone's stomach. So they can do this exercise on a ball. That's going to add more instability.
Yeah.
Get it.
Oh my god.
Yeah, it's like Ellis supporting you.
Closing all those days that you missed your exercise workout because you're studying. You have no sympathy. More. Give me more. 1, 2, 3, 4. You can get it.
Yeah, it's a little hard to read.
My powerhouse hurts.
I spent 8 hours cleaning out one of the beds in my landscape and chopping ferns. So I do this for a while. Then I'd reach up and try to prove my roadies to give me some extension of this ability. Even though I'm low to the ground, it's still hard work. It is. Alright, so let's everybody grab a foam roll. We're gonna do a foam roll progression.
Start ones, dude.
Alright.
Dude.
There you go.
Recording?
Oh, sure, take the soft one.
That's what it was.
Eventually feel like it's
Back in line. That's alright. They gotta be tough. They gotta be
They're like tie-dyes. They sell them at the LCCMP building for what, $13?
So you're going to be rolling around a bit, so at some point you're probably going to want to make like a floor because moving on.
Bottom of building 4. Isn't it? It's bottom, what is it? Huh? How much are they? 13? No, at the PE building right next door.
Yeah, they're less than 50 bucks.
They're like 13.50.
Oh, here?
Alright, so live on your account wise, head is on the roll. Your pelvis should be on the roll. Most of what we're going to do is going to be on the round, the full round. So if you're not on a round one, you're not going to be able to rock as you do on some of them. So it'll be slightly modified. Just be aware of that. So just let everything settle. Let gravity pull you into perfect posture. So your head is on the roll, your pelvis is on the roll. Think about gravity pulling straight down, perpendicular to you. So it's going to pull you back into the chin top. It's going to flatten out your thoracic kyphosis a little bit because we're so kyphotic from sitting on noodle for hours and hours and hours. It's going to flatten out the low back a little bit. The low back will probably not completely touch the roll, which is fine. It's going to stabilize or tilt your pelvis into the correct position if your knees are bent and your feet are on the floor. Arms are just relaxed at the side at this point.
How much knee bending is that?
You're going to want to be probably 90 degrees. It depends on your comfort level. If your feet are too far away from you, that's going to put you in a little more anterior tilt. You don't want your feet all the way up parallel with your backside. You don't want to be that close to your body. Just find what's comfortable. You don't want the feet to be too close together, otherwise you're going to have less stability. So base of support here, you still want feet to be able to support you. Okay, turn the palms up towards the ceiling. See if you can relax your elbows onto the floor. See if your shoulder blades will just release and relax over both sides of the foam roll. Now I very, very gently want you to rock to one side, back to the center, and rock to the other side. And if you're on a round roll, you're actually going to move laterally some. I want you not to let your whole body roll to the side off of the foam roll. I want you to think about keeping your body level or keeping it flat. So we're working some trunk control because you actually have to use your core muscles to help keep you on the roll. And we're also getting a little bit of soft tissue mobilization because, as I mentioned last week, you're almost like the dough over the rolling pin and you're splaying the muscle fibers in all directions as you roll over them. Okay, see how far you can go. Actually stretch one hand out away from you, just sliding along the floor if you've got enough room. Just reach your hand to one side, see if you can slide your body off the roll just a little bit. Come back to the center and then slide to the other side. Just keep the hand and the forearm on the floor if you can. You may hear Feldenkrais at some point in your career. Some of this is Feldenkrais based, which I won't go into. It's fairly complicated, but we're working on body awareness and control. Okay, so that's moving across the foam roll. Now come back to the center, and I want you to bring your hands back down to the sides. I want you to point your thumbs towards the ceiling, and keep your posture, keep your chin tucked, keep your pelvis stable, and raise the hands. So flex your shoulders, reach all the way up and overhead. See if you can touch your thumbs to the floor. Or poke your neighbor. Back down. So when you instruct a patient in these exercises, you need to have plenty of room. Think about the surface of the floor at home. So if someone's on carpet, they're not going to be able to roll quite as easily as if they're on wood floor, laminate floor, tile. Be aware of what they're wearing. If they have a hoodie on, as we go through some of these exercises, it can get caught. So you may need to have them in a t-shirt or something else, and you may need to have them tuck it in because the back of the t-shirt sometimes gets caught as well.
Long hair too.
Long hair as well, yes. Keep the hair pulled back. So as you're going through these motions, you should keep your spine, keep your posture still. You're not arching your back. If I have a patient who's going into shoulder flexion and they either start to lose their chin tuck or I start to see their lumbar spine go into extension and come up off of the foam roll, I tell them to stop right there. We're wanting to prevent and correct substitutions on the foam roll just like we do with all of our other exercises. So if they can't go any further, I need to work on their spinal mobility in a different direction as well and not let them continue to cheat and cause more problems by cheating with this motion. Okay, so now bring your hands back down to your sides. Okay, I want you to think about the snow angel that we did last week. See if you can drag your hands along the floor, up and overhead, keeping them on the floor the whole time. See if you can touch hands and come back down. I think some of you are a little tight in your quarters there, so it won't be quite as free-flowing. But you should have enough shoulder and thoracic mobility to drag your hands all the way along the floor, touch them overhead, and come back down into a full snow
So right when I get about here, I have two knots that as soon as I pass right there, both of them slip.
Not uncommon, not uncommon at all.
Some little break.
We're gonna work on that. We're gonna work on that in just a few minutes. Okay, now let's bring your hands straight up overhead, clasp your hands. Okay. This is a great one I use for my golfers all the time. You can either clasp your fingers together or you can just keep your palms and fingers in touch. But I want you to keep your body nice and still. Your lower body is gonna stay put. Your head's gonna stay put. And I just want you to bring your hands to one side, rotate. Keep your hands together though. Okay. Rotate to one side. You can go a little farther by letting your same side elbow bend if you need to. So this go around, we're keeping the head as still as possible and the lower body still. But then we can also let the spine move with us. So you can rotate the neck, head, shoulders together to one side. Keep the elbows straight. Head, neck, shoulders to the other side. Keep the elbows straight. So you're almost twisting yourself opposite directions because your legs want to go one direction while your hands and head go the other. So this is a great one for our golfers and our baseball players and our softball players because they need to keep mobility both directions. You can modify this a little bit and actually make a box with your arms. So think Adrian or Jeannie. Bend your elbows. So here we are. Okay, so you make a box with your arms straight overhead. And you can do your rotation there. So instead of a long lever arm, with your hands out in front of you, you're just bent in your elbows. Okay, so try to maintain the box the whole time. You're not letting your arms move out of that box position. Alright, so now take your hands back down to your sides. Now we're going to do some more stabilization. So a lot of that was more mobility exercises. We're trying to get the spine to move. Now let's hold the spine nice and still. So back stays as flat as you can keep it. Kegel comes in. Core muscles are on. Now I just want you to raise one hand up and overhead. Don't let your body roll at all. See if you can keep that foam roll as perfectly still as possible. Full shoulder flexion all the way up and overhead and then back down without letting yourself move, and then do the other arm. Okay, nice and slow and controlled. One side, then the other. It's like we're in this weird slow motion world right now. I should talk to you. Okay, now see if you can do both arms up and overhead, not letting the foam roll move at all. So last time we were working more on mobility, this time I want you to really concentrate on keeping the roll still, no movement at all with it. Okay, now hands down on the floor, just in a nice relaxed position. Kegel, pelvis stays still, and I want you to lift one foot up off of the floor, so a little mini march. Don't let the foam roll at all. See if you can keep it nice and still. Don't roll off. Don't roll off.
Nope.
Don't roll off. So nice and slow up, nice and slow down. No flopping. A little bit harder with your legs for sure. Okay, just like we did on the exercise ball, the Swiss ball, you can do opposite arm and leg. So do contralateral arm and leg together. Don't let yourself roll. So if someone has a hard time, and they have really bad trunk control with things like this, you could move them back down to the half foam roll. So now they're not on the full round one. It's not going to be rolling underneath them quite so much. If someone has trouble with the pressure of this foam roll, you can add a towel to it to give an extra layer, or they sell foam rolls that are spongy. They're pink. They're like the green and white, but but they're pink and white and they're more spongy, much more comfortable on the spine. They're not gonna be as good for our mobilizing exercises we're gonna do here in a minute. And then also you can lower it back down where Brian had started with some of our exercises previously with just a rolled up towel. So I'll take a beach towel, fold it in half and then roll it up and start people on that, if they need a lesser challenge or is uncomfortable on their back. Okay? Lots of different exercises you can do on the foam roll here. I have little handouts that I have drawn stick figure pictures of all of these different things for folks. You can take pictures of them doing it, however you want to do it. There are some fancy little pre-packaged programs that you can use. So this has all been in the same plane as your foam roll, so we've been vertical on the foam roll. So now I want you to make your graceful dismount rolling off the side. I see a hand waving, but I can't see whose hand it is up near the door.
When you're doing the one-leg lift, are your arms supporting you at all, or should that's when you're.
Depends on how much you wanna challenge the person.
Right. Ultimately, we don't want to have to press with the hand in the opposite foot, but realistically you are going to, especially initially. As you get better, then I'm cueing the patient. Don't push so much with your hand, or don't be light with your pressure at your foot in your hand, but you're going to use those as a counterbalance initially. All right, so nice graceful dismounts. Now I want you to turn the foam roll the other direction. So it's going to be crossways or horizontal instead of vertical.
I like blue and I like
All right,
colors.
so just you already in position, just lock your elbows behind your foam roll.
Better than plain white.
And I want you to slide yourself down a little bit so your foam roll hits you bottom of the shoulder blades, so about inferior border of the shoulder blades. Okay? You're going to put your hands behind your head, just to support your head, not to pull on your head, just to give yourself some support. Keep the head lined up with the spine. We don't want to go into cervical flexion. We want to keep everything lined up nice and straight. Feet are going to be apart a little bit, about hip width or so. And now you're going to lift your backside up off of the floor.
You gotta put your feet flat on the
Okay,
ground.
so knees are bent.
And then you bridge up.
Yeah, so bridge up, keep the spine nice and flat. And you're going to roll forward and backward on that foam roll. Your spine stays straight the whole time.
Okay, ready?
You're rolling
bridge.
over it.
Head back.
Keep your head in line with the
Okay,
spine.
well, maybe not that
There
far.
you go.
Okay, now roll back
If
and
this
forth.
hurts,
Bend your
don't
knees
do
and
it.
straighten.
Yeah.
Back more.
Full support.
Back more. Head back. Okay, now roll back and
You're
forth.
rolling
Bend and flex your
yourself
knees.
over it. I tell patients
Stand
kind
and
of
flex
like,
your knees.
you're an iron rolling over something.
Now
Keep
let your
your
hip.
spine nice and flat.
Bring your head back.
If you find a spot that's uncomfortable,
Help you out here.
ideally we want to work on that spot. You may have little trigger points, little muscle spasms.
Rock back and forth.
When your hands are behind your head, that is going to abduct your shoulder blades a little bit so you can get into the muscles between your scapula, which tend to have little knots from hanging on them all day long.
How far are you gonna roll back?
As far as you can go, but not below your ribs.
Breathe. You have to take deep breaths.
Not below your what?
Not below your ribs.
Nice
So
deep
don't go
breath.
any lower.
Okay.
Don't go any lower. Otherwise, two things happen. More of your body weight is over the roll, and you're going to strain yourself, tipping backwards, and you're no longer on the tissues that we want to work.
I would say almost half patients can't tolerate this at first.
Right.
You have to work your way into it.
And the softer the roll initially, the better. You can, what I like to tell patients, you can roll a nice long roll up and down, then you can go
Raise
maybe
it a little higher.
inferior borders of the shoulder blades, just do a little half roll,
Take some deep breaths and roll.
just a smaller range of motion, then you can go up to the middle of the shoulder blades, do a half
Feel the
roll.
burden of that
You
one.
don't want to go all the way up to C6. You want to stop C7-ish. You shouldn't be all the way up on your neck, and a lot of people won't even tolerate it that high.
That's what I feel. Feel that. Feel a little cavitation.
That's right. Roll into it. Roll into it. Some of your patients, it's going to sound like pop, 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 all the way up and down, because they've not extended extended through the thoracic spine for a long time. If the rolling is too much, or you're on a half foam roll that doesn't roll, park your backside back down on the floor. Keep your hands behind your head, and just extend over it. So now instead of rolling, you're just extending your thoracic spine over it. So it's like a fulcrum, and you're just extending. So if someone's really tight through their upper thoracic spine, I may have them just in this position, rocking, extending back over top of that foam roll. There are many other things that you can do on foam roll, but these are some of the basics for mobilizing the spine and working on stabilizing through the spine, so we can do both at once. All right. How's everybody doing? I hear some little groans. So this is probably one of my favorite exercise modalities, exercise tools, very inexpensive. I've had folks that do some traveling, they just have one of these that they take with them. And when they drive and they are on planes in those funky positions and flex forward, they'll take one of these with them. There are smaller diameter foam rolls as well, so these are pretty thick. These are the 36-inch by 6-inch foam rolls. They make shorter ones. They make half foam rolls, which we have. And they also make smaller diameter. They have, I think, a 3-inch and a 4-inch. So if it's someone who is tiny, who doesn't have a whole lot of muscle mass and a whole lot of body weight, oftentimes I'll put them on a smaller diameter foam roll. They don't need to be on quite as large a one. Or if it is someone that travels a lot, they can usually fit one of these smaller 4-inch ones in their big suitcase. So I've had patients that will take those with them. The small ones, these take up too much space for most of them, but I have some diehards that take a foam roll with them wherever they go, no matter what. You can cut them in half and just have a smaller one. I know at maybe Fred Meyer, Target, Dick's, a few of the sporting goods places I've seen, even at REI, they have just a little 1-foot long one that you can do other things with as well. But you can roll on it. It's not going to be quite as wide, but you can roll on it. A lot of times people are working soft tissue work through their legs and quads, hamstrings, ankle bands, lots of things to do. I love these. Yeah.
Would they have at places like REI and Dick's Sporting Goods, would they have the softer ones too?
Not typically.
Where can you
Most
find
of those places it's just standard. I order those online. I
Okay.
don't think Lane carries them. We used to, with my outpatient clinic, we ordered at least 3 or 4 different varieties, so we could issue whichever ones we wanted. But I've had pretty good success with people using the white foam roll and then just having them put a towel, so take a beach towel or something with several layers. I've had them do that, and you can't do as much rolling, but just the pad is enough to help them. But online is where I've ordered a lot of things, just punching in soft foam roll. They're pink. I don't know what brand. It's the same one as the green ones, the green and white ones.
Roller roller?
The roller. Okay. So you can look them up, but I've gotten them online multiple times, and they're just a little squishier. So keep in mind that the white ones, if this is something I usually have folks do once or twice a day while we're working with them, and it's a nice little posture reset to do maybe every other day or at least once a week as they've discharged and continue doing. These are going to break down much quicker than the other foam rolls. So my old one had a big sway in it because I rolled on it all the time, every day, a couple of times a day. So these are going to break down. So think about the cost if these were, $10, $12, something like that. But it's something you're going to have someone use every day for months. They're going to need to buy a new one within a few months. Whereas the green and white ones, those are really sturdy material. The black ones are really firm. They're more like styrofoam. They, I found, have a lot of static cling issues. And if you're someone with long hair, my hair would always get stuck on them with static. And then also there are just some other varieties. So look at whatever they're made out of and see what the firmness is if you do look at online,
any like go hards, you use like PVC pipe or anything like that for some extreme myofascial release?
No. Not. They do have the stick and they have rollers that you don't lay on and roll, but you could hold them on your body and dig. I have a roller at home for legs. So there's that kind of stuff, but no, and I would not prescribe someone that either. I haven't seen that yet. Who knows? People do all kinds of crazy things. But yeah, these foam rolls work really well. Water noodles don't work the same. A lot of people that have bought a water noodle at Walmart and tried to use it. You can lie on them lengthwise. That does help. You can do that, but you can't roll on them quite the same as these. But if someone just wants to start with a water noodle that they can get for a couple bucks at Fred Meyer, they can easily do that. They're typically a little smaller diameter, and then they will work double duty during summertime. And they can go get on them. And then we do all kinds of aquatic exercises with them as well. Okay. So, highly recommend, but there are some patients who are not going to use these. Your osteoporotic patients who tend to have compression fractures, no. Your stenotic patients that need to be in a flex position to help relieve some pain, we can work on getting them back into as much of a normalized posture as we can, but we do not want to force them back on a foam roll, because that's going to increase their symptoms. If it's somebody that is a fall risk or cannot get up off the floor, we don't want to have them on the floor on a foam roll and not be able to get back up. So just make sure that you're aware of what else is going on with the person and don't just randomly hand out foam rolls. Questions? How's everybody feel after that? Do you feel a little meat tenderized? Little pounded through the spine? Who needs a massage when you've got your own foam?